Mr. Chairman, before I go to my question, I just simply want to say, I want to echo your comments as someone whose mother had a 10-year-long goodbye with Alzheimer's. We have a moral as well as an economic imperative to end Alzheimer's in our time, and so I hope the budget will reflect that as well. Mr. Secretary, for years, communities across the country have struggled to fill major provider workforce gaps, a growing crisis exacerbated by the pandemic. I've long championed legislation to address the physician shortage by increasing the number of Medicare-funded graduate medical education slots. And based on my legislation, the Resident Physician Shortage Reduction Act, Congress authorized the creation of 1,000 new Medicare-funded GME slots in the Consolidated Appropriations Act of 2021. And it outlined specific eligibility criteria for distributing these slots. However, the Kingdom of CMS its final rule for 2022 and again in 2023 included additional criteria not specified in the law. This additional location-specific prioritization unfairly disadvantages states who have few geographic or population HPSAs. As a result, New Jersey and other states were completely shut out from obtaining these critical residency positions. The CAA of 2021 clearly specifies that the Secretary shall, not may, shall distribute up to 200 residency positions each year and shall distribute not less than 10% of the residency positions to each of 4 specified categories of providers. That's the law. That's what Congress's intent was. Now, I raised this with CMS last year. They failed to address this issue. Can I have your commitment to work with me to revise the methodology used to distribute future residency positions so that we follow Congress's intent, the law, and states are not totally shut out of this program?
Senator, first, thank you very much for the work you've done on graduate medical education, and absolutely, you have my commitment to work with you on this.
Thank you. Now, I'm concerned that the proposed advance notice Medicare Advantage rate announcement will create further health disparities for the 640,000 Medicare Advantage beneficiaries in Puerto Rico. As you know, Puerto Rico seniors overwhelmingly depend on the MA program, with an MA penetration rate of 94% among beneficiaries eligible for Medicare Parts A and B. The proposed changes could impose the largest year-to-year reduction in federal health funding to Puerto Rico, a change that is harmful not only to the most vulnerable beneficiaries, but to the island's healthcare system and economy, one that we have been working towards improving. This is going to set them back. Further, the MA program in Puerto Rico supports health access and equity by filling gaps in care resulting from the island's exclusion from many other federal health benefits. I'm concerned these changes could undermine progress we've made to date to address disparities on the island, including recent funding gains achieved for the Medicaid program, which I fought for. What is the administration's plan to ensure any proposed changes are not magnifying disparities and reducing services provided to beneficiaries on the island who are United States citizens?
Senator, thank you for the question. And as we mentioned earlier, when 67 million people count on Medicare, about half of them count on it within the managed care program of Medicare, we have to make sure we get it right. We're in the process of reviewing all the comments that we received based on that advance notice. And what the President has said is we will guarantee that there will be no cuts to the benefits under Medicare in this proposal, that the providers will see, in most cases, an increase, a substantial increase in some cases, to the monies they're receiving, reimbursement monies they're receiving.
Yeah, and this is, with all due respect, this is in the broader context. But you've got to look at Puerto Rico specifically in the disproportionate way it gets affected. And so I'm worried that while we're talking broadly, the effect in Puerto Rico for the 3.5 million United States citizens is disproportionate. So I'm going to follow up with a letter regarding Medicare Advantage in Puerto Rico, urging you to address anomalies in the rate formula to mitigate funding disparities for the island.
Look forward to that.
Finally, last month, the New York Times published a disturbing report on the illegal use of migrant child labor by several major companies. Some as young as 13-year-olds are unaccompanied minors who came to the United States, placed with sponsors by the Office of Refugee Resettlement. often made to work long hours in hazardous conditions. What are we doing to make sure that that does not happen again?
And Senator, like you, I have 3 daughters. Children are children. We should treat every child in America the way we would expect to have our children treated. It is a serious issue when someone claims that a child is being forced to work, especially in dangerous conditions. And we take very seriously our role at HHS to make sure that while we have custody of a child, and remember, we receive custody of these unaccompanied migrant kids from the Department of Homeland Security. When we do, we are obligated to provide them with the care that you would expect for a child while we're in the process of trying to find them a suitable setting to live in, because a large congregate care setting is not the most ideal for any child. And so we go through the process of trying to look for a sponsor. We go through a vetting process where we vet all potential sponsors. And by the way, almost all, about 90% of those sponsors end up being a family member, an immediate family member. And so what we try to do is make sure that when we do finally place that child in the hands of a sponsor, that they will receive the care that they're supposed to. What we're finding is that oftentimes a lot of these children are now being employed. And I hope that we go aggressively, we all go aggressively, and any employer that would think that it's right to allow a 12 or 13-year-old to work in conditions that aren't even safe for adults. And that's where we have to go and make sure that we're not failing children. And that's why we announced that in a joint effort, the Department of Labor and the Department of Health and Human Services will work to try to make sure that we can do what we can within our jurisdiction to avoid that happening. At HHS, that means trying to get sight from DOL if they know of a particular individual who's seeking to be a sponsor who may be engaged in the practice of using or employing or allowing kids to be employed in ways that are detrimental to them. And we're going to try to do the best we can to make sure we have that sight early so that no sponsor like that would ever pass our vetting process.
Thank you, Mr. Chairman.
I thank my colleague, and I want my colleague to know I appreciate his leadership, and I especially want to help with that last point that you made. This is outrageous, that companies are exploiting 12-year-olds in order to make a quick buck. They're taking advantage of these kids. It's outrageous, and look forward to working with you and following your lead.